again. Welcome back to White Coat Wednesday. So for those who don't know, for those who are new to the channel, I am a medical social worker, clinical social worker, and I know many of you may be wondering, like, why is this girl recording videos in a white coat, in a lab coat? So I just wanted to put it out there that not only does doctors, physicians, pharmacists, not only do they wear white coats in the medical field, but social workers wear white coats as well. And a lot of times it does not have to do with the status of who you are. It's just to, well, I guess it does. It does has a lot to do with the status of who you are, but it helps kind of help the patients differentiate. I have a hard time saying that word. Differentiate who you are in hospital. So if you're not in scrubs, you're not a nurse, you're not a PCT or a CNA. So it's just to distinguish who you are in hospital. And any clinical or professional work, 9 times out of 10, most hospitals require lab coats. So today, as you can see by the title of this video, this will be a vlog regarding medical social work and the labor delivery department. So what to expect as a labor and delivery social worker is what I will be discussing today. It's an interesting topic. It's a fun topic. I also would like to just shed light on a few topics that are not touched within the community, and I want to shed light on them topics because a lot of moms, or even trying to conceive moms, and for those who don't know, trying to conceive moms are moms that are trying to become moms, trying to get pregnant, and a lot of those mothers don't know the protocol of different hospital regulations. So I just want to shed light on a few factors within the labor and delivery department and unit and what to expect. So a typical day on a labor and delivery unit, you will start off by printing off your census. You'll go to morning rounds, as I discussed in my last video. So rounds is where the nurses will pretty much give us a summary of the patients, and you will listen for any concerning social problems that are discussed from each nurse. So if a nurse give report on someone named Sally who has been sexually assaulted and is now 9 weeks pregnant, we will look at that, and that will instantly trigger a red flag in our head. We'll highlight, or however way you decide to practice or make your cases stand out on your census. So you either highlight that case and you will ask the nurse a little bit more questions for details. Is it safe for me going to speak with this patient about what happened? And then based off the report you get on each patient, that is pretty much how your day will go about going to view those patients and speak with them. We also have consults, which meaning, although we heard about Sally and rounds, the doctors may not be on the same page as the nurses, so they may go in and put an additional consult in, which you already kind of knew, like, yeah, I need to prioritize this case. So we'll print off our consult list, and our consult list is pretty much a list where the doctors put in the note that will trigger an alert. It will trigger an alert to our department. It will trigger an alert to the social workers to go and look at this patient, and they'll kind of briefly explain why we are getting this consult. So a lot of times as a medical, or I should say a labor and delivery social worker, we address cases such as domestic violence, homelessness, rape, positive marijuana moms, positive drugs. So with our domestic violence cases, our main goal, or your main goal as a social worker, is to make sure your patient is safe returning home, and to make sure the mom and baby are not in harm's way when mom decides to deliver the baby. In most cases with domestic violence, we tend to follow those cases. So if the mom come in on January 1st, we'll open the case, and then the mom later come in February for like a random nausea, vomiting, and she happens to get admitted, or high blood pressure, whatever the medical concern is. We kind of got our eyes and our antennas, and we got our radars on for that patient, because we want to make sure that we follow that patient up into delivery, because we want to make sure like mom is safe, baby is safe before we clear them from our hands. So with domestic violence, we just have to ask different questions. You want to make sure you confirm the patient's demographics, the patient's home address, because you want to make sure if you have to get CPS involved, that they have that correct information on file. And another case you will experience on the labor and delivery unit, you will have to discuss positive marijuana screenings in our moms. Here in Michigan, smoking marijuana while pregnant is not legal. A lot of people like to give us backlash and say, well, it's legal in Michigan. How is it not legal? It is not legal for a child to consume any drug in Michigan, any drug. So you got to think about it. What you're consuming, your baby is consuming. So if we do get a consult of a mom smoking marijuana, she's positive, we wait until the baby is delivered, and the nurses have to get a sample of the baby's poop and urine. And if the baby test is positive, we have to automatically get CPS involved. CPS don't always take babies from the home for marijuana use, but if there's like pending history of CPS cases, then it's out of our hands on what they decide to do on whether or not we hold that baby in the hospital. And what I mean by previous CPS cases is like, for an example, mom had a history of getting all her children taken away. Well, her smoking weed actually triggered the system for us to have to get in contact with CPS, and then CPS is like, oh, well, how ironic that this mom actually does not have custody of her children. So that's part of what to expect when dealing with the substance abuse side. If we have any other drugs though, because like for marijuana, we do not hold babies here. The laws have changed. We don't hold babies for marijuana use. However, any other drugs outside of marijuana that was not prescribed by your doctor is going to trigger the system, and we're going to 9 times out of 10 put a hold on a baby. So if cocaine is in your system, heroin is in your system, we're holding. We can't let you go home with that baby. So that's something to expect as a labor and delivery social worker. And those are some of the things you will be doing in that role. I personally love labor and delivery over geriatrics and adults, because you feel more like a social worker. You're actually sitting down and you're addressing different concerns. Oh, not to mention, we also address any symptoms of depression or anxiety, because again, our goal as labor and delivery social workers are to make sure that mom and baby are safe. And if mom mental health is not well, we don't know if mom is going to be well when taking care of the baby. So we like to give them all the resources to outpatient clinics. We like to tell them to follow up with their PCP within 6 months if they start to feel any postpartum depression. So we do address social concerns and mental health. So that part of being a labor and delivery social worker I love, because I feel like I can now use my therapy skills that I learned in school versus on the medical side where we're doing a whole range of things, like we're doing medical things, which I will have a video discussing. And this is just a personal stance on the smoking while pregnant. So yes, I get it. A lot of moms smoke marijuana while they're pregnant because it helps with their nausea and vomiting. I'm no one to judge, but I like to put this information out there for my young moms. You don't want to trigger anything. You don't want anything to trigger in the system if you have struggles already going on in your life right now. Like if you're not in your own home, you're struggling to get a job, you're struggling to make ends meet at home, and let's just say you already have a history with Child Protective Services, you don't want anything alarming to trigger the system while you're at the hospital trying to give birth to this baby, to where it's going to bring you down more. Because as a Black sister, or just in general, not even to just say Black, but it hurts me more when I see my people in these situations, because these are things that can be prevented. And just to keep danger out of your way, harm out of your way, don't smoke, don't do any drugs while pregnant, because it's only going to make your life harder. This is for everyone at this point. Like, it's going to make your life harder, even with the newer moms, the younger moms. Like, you don't want to do any type of drugs while pregnant, because you're going to now have CPS involved for what? Something that could have been prevented, something that could have been put on standby until after baby is due. But like I said, I'm no one to judge. I don't have kids of my own. I never experienced being pregnant, so I don't know the ups and downs of nausea, pain, and things like that. So another thing to expect as a labor and delivery social worker, you will also be addressing car seat issues. You're going to have to make sure that mom, baby have diapers, wipes, crib. The main things is cribs, car seat, and diapers and wipes. I guess they're all main things, but you know, with safe sleeping and SIDS been on the rise, we have to confirm that baby has a crib, and the baby also have to have a car seat that passes the car seat inspection as well. As a labor and delivery social worker, you will also have your eyes and ears out for moms suffering with mental illness such as bipolar, schizophrenia. You want to make sure that you have a sound plan in place. So our goal here as a social worker is to talk to the patient, gather as much social information to make it look decent enough for the patient to have a safe discharge. We have to document it in a way the doctor look at it and they say, okay, I'm not concerned about this patient going home and caring for this little one. So if we have a mom with schizophrenia, and those who know, schizophrenia is a very, 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 very challenging mental health concern. So as a new mom with schizophrenia, that's alarming to us. So we want to make sure who is the support system for that patient. We want to make sure is mom current on any medication. We want to make sure mom is undergoing proper treatment. We want to make sure that mom and dad are having healthy relationships. We want to make sure we get all the information from dad, his side of the family, so that we'll know who to reach out to when it's time to be discharged. Because not only are you going to talk to the patient that has schizophrenia, but you're also going to turn around and address the same assessment that you have with that mom, you're going to have with whoever that individual lives with. Because one, you want to make sure that patient doesn't have a guardian, a legal guardian. A legal guardian is someone who makes the decision for another individual. That individual no longer can make their own decisions. So if I'm 15 years old and I have a guardian, but I'm about to give birth to my baby, I have to, me as a social worker, have to now not only go over the 14-year-old's rights, we have to go and talk to her guardian and to make sure that this patient can go home with the baby. And we have to make sure that the guardian is aware of the responsibilities of caring for the new baby on top of the mom with schizophrenia. So that's one thing I really love, because again, in the medical field, a lot of times as social workers, our scope is not just social work. We do a lot of things that's kind of like nursing related, but when you're on the labor and delivery side, it's more social. You really get attached to the social needs, and you're actually building a relationship with these patients and making sure that they have an end goal. So it's like you're kind of following your cases from beginning to the end. Overall, our goal is to make sure we have a safe discharge. That was just a little snippet of what to expect as a labor and delivery social worker. I do plan to post a little bit more content about the different areas of medical social work. This was just a snippet. I will remix this video in the future. However, I just want to get content out there, and then based off my subscribers and what they would like to hear, I'll just go from there. Thank you for watching.